A case of a flesh-eating bacteria has popped up in Santa Rosa County, and now officials are urging people to watch out before hitting the waters. Yesterday, we told you about a reported case in Escambia County, Florida. It is unclear tonight if this is the same person who died last week after fishing in the Santa Rosa Sound. Local 15's Madupe Dowu spoke with doctors today about the possibly fatal bacteria. Madupe health officials are warning swimmers to be on the lookout before they get into the water.
That's right, Kim. You know, we just found out moments ago that there's actually been a case here in Mobile County. Health officials believe a man contracted it after going into the water with the sore, something Dr. O says you should never do.
Yeah, once it gets in the bloodstream, it can it just runs rampant.
Vibrio Vulnificus, a tiny flesh-eating bacteria that can deform limbs and so much more.
If you guess wrong with this one, I mean, it can be life-threatening, as we've seen in Florida recently.
27 cases have been reported in Florida, causing 9 deaths. One Santa Rosa County man says his friend died just days after a fishing trip where he entered the water with an open wound on his leg.
By Wednesday afternoon, after that fishing trip, his leg had swollen up. By Friday night, it had gotten into his bloodstream and he passed away.
Dr. O says the bacteria can be found here too, in the Gulf and near Mobile Bay. There are two ways.
One is from an open sore on the body, typically the legs, where you walk out into the warm, salty or brackish water, bay water, or in the Gulf. The other way would be ingesting it or eating it, like raw oysters.
He says those with a compromised immune system are even at more risk to get the infection.
If you have hepatitis, liver disease from a lot of alcohol ingestion, that sort of thing really puts you at almost 80 times the risk of a normal person. Just be cautious. You know, the bacteria's been there forever. It's a known hazard down here.
Now, symptoms include nausea, vomiting, abdominal pain, and blisters at the site of the wound. Dr. O says the infection can be treated with antibiotics if it's caught in time, so it's important to seek medical help if you experience any of those symptoms. Kim?